Good afternoon, everyone, and welcome to the City of Alameda's Mayor's COVID-19 Town Hall. I'm Sarah Henry, the city's Public Information Officer. Mayor Ashcraft invited special guest Congresswoman Barbara Lee to join her today. Please note, all participants have been muted. To submit a question, please use the chat feature. Following their opening comments, the Mayor and Congresswoman will be available to answer your questions. I'd now like to turn today's Town Hall over to Alameda Mayor Marilyn Ezzy Ashcraft.
Thank you so much, Sarah. And hello, everyone. Welcome. It's lovely to see you virtually. And I am so excited that we have a special honored guest, our very own Barbara Lee, Congresswoman, who was scheduled to be my guest a week ago, but she was back in Washington, D.C. Actually, she was on an airplane flying back from Washington, D.C. because, as I'm sure you know, the House voted last week on the most recent coronavirus relief package, and she had to be back there for the vote, so she wasn't able to join us, but she kindly agreed to be my guest this week. She does have, as you might imagine, she's just hopping from virtual meeting to phone call and on and on, so she's got to leave us about 10 minutes to 5. So any questions you have just for the mayor, we'll hold till after the Congresswoman has had to leave. But I mean, we are so blessed to have Congresswoman Barbara Lee representing us in Washington, D.C. She is looking out for our best interests. And I am going to turn the floor over to her because she will tell you about what she and other Democrats have been fighting for their constituents. She knows that people are hurting, whether it's our residents, our renters, our homeowners, our small businesses. People are fearful, people are anxious, there's so much uncertainty. So we'd love to hear about this package that you all passed. As the mayor of a city that is less than 500,000 residents, as are most cities in the Bay Area, we'd love to know when we might expect some direct federal funding from the government. And there's just lots to talk about, testing and elections and the census and all that. But without any further ado, I know Barbara Lee speaks for me, and I'm going to let her speak to all of you. So Congresswoman, thank you so much for being here. We welcome you. The floor is yours.
Thank you very much, Mayor Ashcraft. And let me just say how happy I am to be with you and give a shout out, first of all, to all the work that you're doing, and just say to you, with all of the legislation that we're working on, your input and your guidance and your advice as it relates to the city of Alameda is extremely important. And I hear you loud and clear, and we're fighting for each and every item that you brought to me before this last bill. So thank you again for your leadership and for your partnership. It really does make a difference. Let me also thank all of our frontline and essential workers and those who are really putting their lives on the line for our health and safety and protecting the public. And just know that we are fighting each and every day to make sure that you have your economic security and your health security as a priority in all of the federal bills. And I know the mayor is working to make sure that you are a priority in all of our local efforts. So I just have to take this moment to say thank you so much. Let me just say a couple of things. First of all, yes, I was flying last week, and it's a challenge to get on an airplane. And I'm glad now that the airlines are beginning to tighten up because the physical distancing wasn't appropriate. Some passengers and flight attendants had on masks, some did not. And it's really a health hazard. And so just as FYI, if you don't have to fly, don't fly. But also take precautions. And I think the airlines are beginning to do just that. We passed, and I'll just go over some of the bills that we passed by giving you an update, and I'm going to read a couple of the provisions of the first bill and then the second bill. So if you remember, although this seems like a long time ago, in early March, we passed, it was an $8.3 billion funding package, which provided $3 billion for the development of treatments and a vaccine, and also over $2 billion in public health funding for prevention, preparedness, and response, funding for community health centers, and we put an estimated $7 billion in low-interest SBA loans for small businesses impacted by the pandemic. Of course, we know what happened. many and most small businesses were precluded and shut out. And it was just outrageous. So that's why we had to go back and address the involvement of and the inclusion of small businesses in the second bill. But I'll talk about that in a minute. But also we came together to really provide, it's called the Families First Coronavirus Response Act, which would again address the economic impacts. And what this did was establish paid leave, unemployment benefits, and we added $600 a week to one's unemployment compensation. What we did was we expanded and protected food assistance programs for our seniors and our children, provided for free coronavirus testing for anyone, and that means for anyone, and additional Medicaid funding to address the evolving impacts of the pandemic. And this bill was not enough. It was a good first start, but then we had to go back and pass the $2 trillion stimulus package that gave our workers and economy a much needed boost, but we still have to do more, which I'll talk about in a minute. But this bill put in $200 billion investments in hospitals, healthcare systems, and it really did provide for an increase in testing. We put $100 billion, well, we fenced off $25 billion for testing. And let me tell you, we have to get to where we are able to test communities that are most impacted. And when you look at the horrific disparities based on race and ethnicity, socioeconomic status, we required CDC to do this data collection quickly because we have to have rapid response testing with contact tracing and follow-up. And then we have to have decent housing for people who test positive, because many of our constituents live in multifamily homes. Many are low-wage workers, and many have to share apartments and houses, and we don't want the virus to be transmitted to family members, so we have to find housing that's clean, decent, and safe for isolation for people. But we also put in, now on the small business piece, we added $310 billion for the Paycheck Protection Plan. Now, that was an important piece because when you saw what took place, I mean, again, a lot of our small businesses couldn't even get in the door. So we took $60 billion and we fenced that off to support loans for small, middle-sized business, minority-owned businesses, women-owned businesses, disabled-owned businesses, veteran-owned businesses, and we decided to use alternative funding. Financial institutions such as credit unions now are eligible to provide these loans. Community development financial institutions, community banks, those were precluded or at least weren't able to access it during the first go round. So that $60 billion hopefully will provide for easier access to what our constituents need as it relates to small businesses. We also put in $60 billion for the disaster loan program and the emergency economic disaster loan grants. I believe you can go for $10,000, can turn into a grant. You don't have to pay it back. I would encourage you to do, people who are eligible for that, to do that. We put $75 billion in for hospitals. And then we added $825 million for community health centers and for rural health clinics. And that's extremely important because access to healthcare, oftentimes for many of our constituents, are through community health centers, and yet they've been underfunded. And so we have got to recognize that these provisions, it was $2 trillion, and we had other provisions such as the data collection by the CDC. We have to have the data and track the testing based on the data. But also, we need to address a heck of a lot more. And so now we're working on the third bill. So some of the third bill provisions, of course, first priority funding for state and local governments and for cities under $500,000, 500
population. Yes.
population.
Yes, thank you.
Right now. But
Alameda County thanks you.
That's right. And it's important because when you look at essential workers and frontline workers, we're talking about their jobs. We're talking about police officers, firefighters. We're talking about healthcare workers. We're talking about grocery clerks. We're talking about people who work each and every day during this emergency to make this economy work. And so funding state and local governments, it may just sound like funding state and local governments, right? Could sort of like, what does that mean? It means jobs. It means people, protecting people's jobs and ensuring their health and economic security. And so we have got to do that. And I can just tell you, Democrats, the speaker, all of us are working day and night to try to get that provision negotiated. But also we have to ensure, once again, voter suppression. We have to ensure we have elections coming up. The voter suppression does not increase. We know it's there. We know what happened in this last election. So we don't want to see this global pandemic being used to suppress further the vote. So we have to have money for vote by mail, for absentee voting, so that people can exercise their right to vote. Democracy has to continue even in an emergency. And of course, we tried funding for the Postal Service. Now I have to tell you, our letter carriers, our mail carriers, our Postal Service, extremely important. I mean, and these workers deserve to be protected and they deserve to be funded. Donald Trump doesn't want that. So we're fighting now to make sure that we increase funding for the Postal Service, because we know why they don't want us to fund the Postal Service, because of mail-in ballots. That increases voter participation. Regardless of who you vote for, that increases the ability to vote. So we have got to have more money into Postal Service for mail service. And that's going to be a big fight we're going to have. But we also need to, and we're trying this in the next bill, additional funding for individuals or unemployment insurance. And we have to increase SNAP funding and make it more accessible. You know, Mary Ashcroft, we see now some of our food banks and some of our community organizations doing yeoman's and yeowoman's work. They
Absolutely.
are doing unbelievable work, but yet we see people who never had to rely on a food bank for a meal at the food banks. And so we have got to take care of them. And we have got to make sure that, and the Republicans do not like SNAP. I mean, their constituents are hungry and need food security. And so we're going to fight again. It's always a fight. We want this bipartisan, and that's what we do. But they wouldn't put a dime in this last bill. And even with the lines being as long as they are in their districts, they wouldn't put a dime in there. And so, you know, I work a lot on poverty and poverty reduction. And we're seeing more people now fall below the poverty line. And so we have got to make sure that those living below the poverty line are lifted out of poverty and not go into deeper, persistent poverty. But those who are middle income are beginning to fall below the poverty line. So we have got to shore this economy up, but that means shoring up our people. And so that means providing more money for SNAP. Another thing we're trying to do is, you know, the $1,200 rebate. Okay, that was great, fine. But come on, that was one time. So now we have several proposals. I mean, I'm supporting $3,000 a month until the end of the pandemic. That's probably as far as we can go, even, you know, and they'll probably try to negotiate that down, and plus an additional amount for each child. People, this is not the fault of anyone. Okay, and so people need to guarantee, in many ways, a guaranteed income or a paycheck, or their salary covered through the duration of this pandemic. So these direct assistance payments and rebates are being negotiated now. I'm pushing hard on that because we can't have what we see taking place anywhere in the country. And this is a high cost area, as we all know. And so people deserve to be able to survive during this period. So we're trying to do that in the next bill. Also, we're trying to fix some rules so that nonprofits are able to stay afloat. You know, I think it was a mistake to require nonprofits to go to the SBA for grants and for assistance during this period to keep staff on board. I mean, nonprofits deliver some of the most extraordinary services. And for nonprofits to have to go through the rigmarole of going to SBA and then a bank and, you know, all of the bureaucracy is just overwhelming. And so I want to see a direct funding stream for nonprofits, especially those who are involved in the COVID-19 relief efforts. So we're working on that, trying to get that into the bill. we don't know where any of this is going, but just know that these are just top line negotiations that are taking place, and I'm involved as co-chair of the steering policy committee. And what that means is steering and developing the policy so that we can get a bill done and bringing people together to support some of these policies. So we're working day and night remotely to do that. And just know that Alameda's interests are in the mix. You gave me what Alameda needed in terms of our homeless assistance, in terms of the ability to make sure that there are hygiene and water out stations for people who are unsheltered. And so we're working on all of our McKinney-Bento funding also. We did get a bump in that in the last bill, so I hope that we got some of that here in Alameda County. I haven't tracked the money yet, but hopefully it's trickling down to my district. So thank you again.
Oh, thank you so much, Congresswoman. That makes me feel great. Yeah, for our listeners, that while the Congresswoman wasn't able to join us last week because she was flying back from DC, last Thursday, a week ago, as soon as she got off the floor from that House vote, she had arranged that all of the, I think there's 7 of us mayors in your district, that we were all in a conference call with her. So we heard firsthand and real time right away what had been accomplished. And we're so grateful for your hard work. I know there's probably questions lining up that Sarah has, but I did want to ask, so the next session, I mean, you're working on what will go into this proposal. When do you anticipate the House would go back to vote? Because I know that Speaker Pelosi has said, I'm not calling my people back to DC while there's such an increasing COVID-19 rate in that city. The Senate is apparently immune or something because Mitch McConnell doesn't see it that way. But is, A, do you have any sense of the time frame? And B, what are the chances of perhaps agreeing to do remote votes?
Yeah, well, we're working on the bill right now. Of course, Mitch McConnell doesn't want to see anything take place. So that's the first issue, trying to get Senator McConnell and the Republicans to say yes. Funding also. We did get a bump in that in the last bill. So
whoops, we're getting a little feedback there, Sarah. Okay. Okay, so you got to work on Mitch McConnell.
First, yeah, we got to do that. But secondly, let me tell you, the rates of infection are increasing in the district. In the last bill, so I hope. Well, we're working on the bill right now. Of course, Mitch McConnell doesn't want
let's
to see anything.
see if we can. Let's keep talking, and I think maybe we can just talk over that. Yeah, no,
But let me just say, I think probably 11. I'm not sure the exact number. Capitol police officers have contracted the virus. Construction workers, and so right now, the House physician has advised stick with the health standards that the public has to stick with, but we have to do our job. So we're trying to figure out a way, if we have to vote in person like we did last week, we will follow the physical distancing and do it. We're looking at proposals now in terms of proxy voting, remote voting. Nothing has been settled yet because there are a lot of security issues, but we've got to figure out ways to do this. It was irresponsible, if you ask me, for the Senator McConnell to call the Senate back. Not, I mean, it's how did, and I worry about the workers there. People who work in the food service industry on the Hill, our Capitol police officers, our security people, and these are people who are essential workers on the front lines, and they're not being protected, but yet they have to come to work at the Capitol while we're in session. And so it's not about us, it's really about them. I mean, it is not a safe situation for the workers on Capitol Hill. Staff, I would not allow my staff in the office, period, ...
Wow.
No.
And so while I'm checking to see if we probably have some questions, 2 quick questions. You mentioned that you want to see an increase in SNAP funding, and food security is so important. Right now, the Alameda Unified School District, and I'm pretty sure school districts throughout your district and throughout the state, are providing free meals, grocery bags to children, and they don't even have to be enrolled in the district. They just have to be Alameda residents 18 years or younger. But summer is about, not that the kids are in school now, but the end of school year is coming up. So will there be funding to continue those food assistance programs through the summer?
I think there will, but we're fighting. I can't say for sure, but yes, that's one of our priority items. We've got to feed kids, regardless of whether school is in session, regardless of whether it's summer, whenever. And so, yes, we're fighting for that.
Absolutely. That's good to hear. We absolutely do. I love the concept of a guaranteed paycheck for those who are out of work or underemployed now. And, really that would go so far toward helping our cities and our businesses, because when people have
Yes.
money and some economic security, they can loosen up and spend a little. We're certainly encouraging people to support your local restaurants by ordering takeout. I was on a really exciting call with State Health and Human Services and Department of Agriculture a little earlier today, because we want our restaurants to join in this the Great Plate program that the governor is getting started, where restaurants can they'll be paid to provide meals to homebound seniors as long as they meet the nutritional guidelines. But we could do so much with more assistance.
We could do so much. And you know what, Mayor Ashcroft, this is the time for us to think out of the box. These are extraordinary times, and we have to find creative solutions. And if these solutions can't be found in my district,
yeah,
they can't be found anywhere in the world.
As my friend and neighboring mayor Libby Schaaf likes to say, the Bay Area, I mean, California is leading the nation, but the Bay Area was the first group of counties to do the shelter-in-place order, even a couple days before Governor Newsom.
Yeah, it was Mayor London Breed, and I'm really proud of her.
Mayor London Breed,
standing out there and stepping out there in spite of the criticism and doing it. She led the way.
Absolutely. Yeah, no, our mayors, our governor, you all in Congress, you've been proactive, not reactive, and we are safer for it. And I want to give enough time for answering questions, because we know that the Congresswoman has to jump onto another call. So Sarah, why don't you get us started with the questions that you have?
Absolutely. So here's one that kind of just extends on what you've been talking about. This person appreciates the intention behind the SBA loan program, but they really need more substantial true loans in the mode of the auto industry bailout. We need to do substantial changes to remake ourselves for the world that will be coming in the next few years.
You're right. And we have to do that. And I think this last bill, you can see that there's some concern and a sentiment to restructure everything, starting with our small business community. And so using credit unions and the community development, financial institutions, community banks, we've got to think again out of the box and figure out new ways. I mean, I don't think that they need to go through an application process. If you're in business, you're in business. And they should be eligible. I mean, these businesses provide for jobs and for economic growth and economic stability. And so why go through all of that? So we need to take this time and restructure a lot of these programs.
Here's
a
follow-up
Similar. How can you guarantee that small businesses who really need the loans are getting the money when the LA Lakers can get a loan?
Which was outrageous. We can't guarantee, but I tell you one thing. We have a select committee now established in terms of accountability and transparency, and we're going to look into all of these loans that were received or granted by organizations such as the Lakers. I mean, well, you saw what happened during the first go round with the large restaurants getting
Shake Shack.
Yeah. I mean, it was outrageous. So we're trying to mitigate against that. I don't know how they slipped through on this one, but our committee that's doing the oversight, we have to have transparency and accountability. We've got to put some, I think, tighter strings on this, and we have to negotiate that with the Republicans, leave it to them. They want zero strings. Of course, they want bailouts of all of the big, large industries, and we can't let that happen ever again.
And they want the states to declare bankruptcy, right? And
that is about as ridiculous as it comes. I mean, what in the world was Senator McConnell thinking about during a pandemic to even say that? We're trying to give people hope, trying to make sure people don't die, make sure people don't get sick. And here you're talking about filing bankruptcy, please. That just shows you what we're dealing with, though. That attitude, that mentality. It's horrible.
Here's a person who is talking about how many people are losing their jobs. They also have lost their health insurance. And is Congress going to put anything in place for emergency health insurance?
Yeah, well, we're trying to expand Medicaid, but also, let me tell you, just in terms of right now, our community health centers, I think, are doing a phenomenal job. And so for those who have lost their health insurance, at least as a stopgap measure, find your community health center and get engaged with them, because we don't want anyone to go without healthcare coverage. Of course, testing, we put that funding in the first bill for free testing. And so free testing is available. But this just shows us what the gaps are and the fault lines are in our healthcare system. Personally, I, for one, support Medicare for all. I've always supported single payer, because we see now what happens when you have a fragile healthcare system where you have those who don't have the money, or the states that don't have the coverage through Medicaid, or you have the insurance-driven profit motive industry providing health care. And when you lose your job, what do you do? And so I, for one, believe that we have to look at restructuring our healthcare system as well.
I agree that we have learned a lot through this lens of COVID-19. And so if there is to be a silver lining in this cloud, it's that we have to do things differently going forward, starting in November. I won't say any more than that. Sarah, back to you.
Yes, here's another question from a small business owner saying, as we eventually open up, we want to do it responsibly. And so we'll need guidelines to access the tools to do that. They want access to testing after the critical workers and most vulnerable are taken care of, access to things like good thermometers, and access to capital to change their businesses so that they can safely take care of their customers in the world that'll be changed for a couple of years.
Yeah, and absolutely correct. I think our governor, probably more than most governors, have really set up some guidelines in terms of reopening. He's being very careful, which he should be. And other states are just doing it without adhering to any guidelines. Forget listening to 45 in the White House. I mean, listen to Dr. Fauci and our healthcare advisors and scientists, and listen to Governor Newsom. I mean, he's trying his best to make sure that as we open up, it's done responsibly with the least impact in terms of the health. Because remember, we have to make sure people don't get sick and don't die as a result of this terrible pandemic. That's got to be our priority. At the same time, we've got to make sure that their economic security is there. And that's why we have to have these guaranteed benefits as well, so that we don't rush to open up because of the economy. We need to balance that out. People have to know they're going to get a check, that they're going to be taken care of as we open up. So we can't just say, let's open up. We have, and the governor has said, I think, some pretty reasonable standards that we need to follow.
I agree.
They're asking, how will the stimulus bills eventually be paid for?
Well, I tell you one thing. First of all, the Republicans provided a tax cut for the very, very wealthy and didn't worry how it was going to be paid for. And corporations are making mega profits now, and our defense budget is off the scale. We have the dollars in this country, and we can pay for each and everything we're doing when we prioritize our funding and your tax dollars in a way that puts people first. And so this is an emergency. We can pay our bills, but we have to deal with this emergency now. We saw how they railroaded a huge trillions of dollars tax cuts through. And so the resources are there. It's about priorities and how we prioritize our tax dollars.
Thank you.
Here's the next question. Has there been any consideration to loosen the income restrictions on Cdbg funds in the short term in order to serve businesses that currently do not have any income but had substantial income last year?
I'll have to look into that. I think so, but we'll look into that and get back with you on that specific answer.
Great. The questions
be
are
sure
rolling.
Be sure we have the contact on that.
Absolutely.
Contact person.
Got it. And then here is one. Is there any way on the federal level to do a true rent moratorium, not just putting this on the landlords, but up to their mortgages and banks?
A true rent moratorium. Okay, we did for, I believe, for those living in public assistance, in public housing, a rent moratorium. So HUD, we have to address HUD. We're working now in the Financial Services Committee, because I support a moratorium. They're working now on how to do that, where it's fair to landlords as well as tenants. I think you'll see something in this next bill, but it's a very dicey kind of proposal, but people deserve to be able to stay at home and not be evicted and not be kicked out of their house because they're either late with their mortgage. We're looking at mortgage forbearance also, because some financial institutions are saying, and we've asked them to do this, to delay the mortgage payments. But then what's going to happen in 5 months, 6 months, 7 months, you'll have 5 or 6, 7 months of mortgage payments due, and people without a job, how are you going to pay back, all of those mortgage payments? So we're looking at some issues around forbearance also, but we're working on this very hard.
Here's a resident. She says, thank you to Congresswoman Lee for the additional CARES Act funding. We're very fortunate to receive the PPP this second round. Are there any additional thoughts on extending the PPP forgiveness timeframe and criteria, given many of us brick and mortar businesses are still mandated to be closed until an unknown period? Thus, my employees would not have to have any work to return to immediately since we're closed, yet the forgiveness period clock begins ticking immediately upon funding.
Yeah, and we're looking at that, because I think the forgiveness, and I've already shared this with the people who are writing, so the forgiveness period should be to the end of this pandemic, and then a few months to get back on your feet. So we'll see what they go for. But yeah, this is something that's being seriously considered.
Here's a comment from a college student saying that a lot of students at my university and others across the country want to know what Congress plans to do to help students at the university level.
Well, we're trying to put a moratorium on, and I think on repayment of Pell Grants, and put more funding into supporting students outside of the campus for their distance learning and all of their academic studies, so they don't have to worry about losing a year and losing 6 months. But I think the big thing is the debt that students are acquiring, and we want to put a hold on on the interest that is accumulating on those debts. And for me personally, some of us want to just make this debt-free totally for students, especially during this time. They shouldn't have to worry about any kind of debt. And we're trying to make sure they have the type of resources for wherever they live, because so many, students aren't living in the dorms now, and they have to have the financial ability to stay where they are and do the distance learning.
This person says that they appreciate everything that is being done to support those in need financially, but they're concerned about future tax increases or reduced spending to pay back the debt that we're creating. So do you have any thoughts on what the future will look like?
I have those concerns also, but those are political battles we have to engage in. We need to make sure that that doesn't happen, because as I said earlier, we have the resources in this country. It's a matter of priorities. And I serve on the Appropriations Committee, and we've been fighting against spending cuts for decades now. And we cannot, I'm looking now at, and we're in the process now of trying to write the appropriations bills. Example, I'm looking at the Trump administration's budget. This came in pre-COVID, right? Cuts in the healthcare, cuts in the NIH as it relates to the offices of health disparities that's supposed to address a lot of the issues that we're seeing that has surfaced with people of color in terms of health equity. There are cuts in housing, cuts in education. So this is before COVID. These are political fights we have to engage in, because those cuts we're not going to let happen. And they're going to try to cut more, I know, next year. But again, it's a matter of priorities. And we're going to have to look at the tax code and figure out how to do some of these things. But we can't just say just because we're spending more now in an emergency, we have to raise taxes and cut spending. I mean, that is foolhardy, and we can't let that happen.
Speaking about taxes, is there anything that we can do so that Amazon starts paying their fair share of taxes? They have made billions off this pandemic, and we need to rectify the injustice.
You're right. Federal government, we're working on that. I don't know I'm not on the Ways and Means Committee, but I do know we're having lots of discussions about that. and about those that aren't paying their fair share, not just Amazon, but there are many companies that aren't.
Amazon needs to pay to treat its delivery workers better too, and give them better pay and
Well,
protection.
and protection. I mean, they're part of the essential
They're
workforce.
front line.
Yeah, and they should automatically have PPE. They should automatically have what they need to protect themselves if they're going to be working. And they shouldn't have to choose between a paycheck and their health.
Exactly. I know we got lots of questions,
Yes.
so keep them coming, Sarah, before
Yes. Here's the income limits on the first stimulus check don't really scale to those living in the Bay Area. Will the new funding bill be something that is based on cost of living? $1,200 means something completely different to someone in Alabama versus the Bay Area, for example.
Yeah, I don't think so. I don't think we can get that. I think it'll probably be more based on the regional differences, but I don't believe that it's going to be regionally based with a regional formula. If we could get to 3,000, even though even 3,000 in California is not a lot, we need to up it. But I doubt if we could get the support to do the formula-based income assistance and rebates.
Here's a great question. COVID-19 has shown there are gaps in the supply chain. For example, toilet paper, food, cleaning product distribution. How will the supply chain management be changed to pivot?
Well, they should have, the president should implement fully the Defense Production Act, anticipating the supply chain being broken. A couple of examples, hand sanitizers. I serve on the Appropriations Committee, but I'm also on the subcommittee of agriculture. And this is where, which I had no idea that hand sanitizers, the jurisdiction of sanitizers comes under agriculture, because we have jurisdiction over FDA.
Oh, so, it doesn't come from cows or anything, right?
No, it's FDA. And before we left, I'm noticing no hand sanitizers anywhere. This is just an example. So when Dr. Hahn, the FDA commissioner, came before the subcommittee on agriculture, I asked him about this. And first of all, we were shipping hand sanitizers abroad. That's the first thing. Secondly, the supply chain was broken. Thirdly, he didn't have an answers. And so they went back and talked to the White House task force. I talked to 6 different NIH, CDC, Ag, HHS, all of the federal agencies. No one could kind of figure out what was going on. So finally, we had, and Dr. Hahn, to his credit, had acknowledged this, the supply chain problem, and didn't know how to fix it. And so we issued, and I want a pharmacist to know this, if in fact still it's difficult to get hand sanitizer, it's still hard in many communities, that we issued a directive to pharmacies that are state licensed or federally funded or federally licensed pharmacists to be able to develop their own hand sanitizer. And they sent out the criteria and what needed to be in that to be legal and where they could sell it. And so I found a lot of pharmacy who didn't even know FDA issued that directive. So I'm trying to get the word out to pharmacies that that directive through FDA is there if we're in short supply of hand sanitizer. But that's just an example of how the supply chain is broken. And so if we've got to do the Defense Production Act for everything, because now you look at the meat processing plants. First, it's outrageous what is taking place. They're making these workers, which are mainly Black and brown workers, low wage workers, come to work and not protecting their health at all. You know, some processing plants, maybe some, maybe not. And so the supply chain in meat now is being broken because the planning wasn't done, but 2, because the workers aren't being protected. And so you have a problem with the supply chain there, but you also have a problem with the increase in the virus spreading. And so now these workers have to choose again between a paycheck or their health. And check this, if they don't go to work, they get fired and they're not eligible for unemployment. Oh. So this is a terrible thing that's taking place in this country now with regard to people who are vulnerable and low wage workers and people who live from day to day, just with $7 or $8 an hour. And so the supply chain, that's another break in it. But it's because there's no preparation for a pandemic. And so the Defense Production Act has got to be implemented fully.
Here's a person that says that it's likely that even more people will need subsidized affordable housing after this health and economic crisis. What do you think the best way is to fund the expansion of affordable housing so that more units can be built during the economic downturn?
Great question, whoever
That
that
is.
was.
It is.
I didn't write it, but great question.
Well, I think we have to, again, think out of the box. I'm a big supporter of housing trust funds, and we're going to have to figure out how to make sure that we provide for multifamily units, provide for tax incentives and requirements that there be affordable units, more than a 5 or 6% requirement or a 10%. We're going to have to require in the development of new housing a large affordable factor now. I mean, I've always said 30%. It may need to go way up, I think, in terms of the development of housing. Also, we're going to have to expand the Section 8 vouchers. Again, being on the Appropriations Committee, looking at what this administration is doing, they're trying to cut it. We need to expand them, and we have to deal with the fair market value of Section 8, because I had to get involved, and I don't know if you remember this, Mayor Ashcroft, but several years ago, this was when the Obama administration was in, we would, about 1,000 people were going to lose their rental vouchers, because the fair market value was so low that landlords were beginning, because this is high rent area, to receive 3 times what they were receiving from Section 8. So I had to go back to HUD and say, look, we've got to do a fair market analysis. That's right. so that these people don't get kicked out of their homes, and so the landlords can say, okay, it's you know. So here I was fighting for the tenants and the landlords at the same time. Well, but we have to do things like that.
Absolutely, and it's so important here in the Bay Area, because you, as you said, this is just such a high cost of living area, which is why our renters didn't have safety nets. Nobody was saving up for that rainy day, because they were just, barely making ends meet, and sometimes making the choice between paying their utilities or filling their prescription to be able to keep paying the rent. So, and that was before this pandemic.
Yeah. So housing's got it, but thank God Alameda, took the lead.
Yeah, out at Alameda Point, we have, you have to put at least 25% affordable in to do a housing project. And I've got a lovely senior affordable apartment building that is 100% affordable, 62 units, and half of them are reserved for formerly homeless veterans.
Very good.
What's more fitting out at a former Navy base? I happen to know that the Congresswoman, I believe, was born in Fort Bliss in Texas, because her dad was an Army officer there. But that is just waiting to be opened as soon as we can do that. But
very good, very good. And just so you know, as a side note, we're in the appropriation cycle, so we're working on getting more funding for the Alameda Veterans Facility.
Thank you. Yes,
we're working on that hard.
Every time I'm back in DC, I call on you in your office, and the VA and the Army Corps of Engineers, and we're so grateful for what you've done for that VA clinic that's going to be coming.
But I want them to expedite it. I'm tired of them dragging their feet. This is as a side.
Thank you. Please put in a good word. I know they'll listen to you more than they listen to me.
Oh, yes. No, every time I talk to them, it's got to be expedited. We want our veterans to have this facility that they can be proud of and use. And many veterans are much older, and they need to be able to feel good about what they've advocated for.
Absolutely.
And the wonderful work that's been done through that.
Absolutely. You're doing great work on so many fronts. What else, Sarah? Because I know we're getting to the end of our time with the Congresswoman.
Here's a question on testing. Have you looked at testing requirements similar to food establishment to create ways for workers to be able to be hired during the next while?
Yeah, I think that everybody should be tested. First of all, whether you're asymptomatic or not. I mean, I'm very happy that LA, the mayor of Los Angeles, is providing now free testing for everyone. Mm-hmm. And so we have to do that. If the economy is going to open, we've got to have everyone tested, especially workers who need to be tested, essential workers, restaurant workers, everybody needs to be tested. So we're fighting now to get a national testing strategy from the federal government. But here in California, I think we're a little further ahead, but I really believe we have to have testing for everyone. And it's got to be rapid response testing so people know immediately what the results are. And contact tracing.
And the contact tracing and there's more funding for contact tracing because that's quite a big expense to hire contact tracers.
Yeah. And let me tell you, it's a good. There's new funding, but also new jobs can be created.
Ooh.
Okay.
Yeah.
I know contact tracing. To train healthcare workers, community people who have lost their jobs or need jobs, younger people in Chicago, Mayor Lightfoot, former gang members are being hired now as health outreach workers to provide health education and messages about physical distancing, but also contact tracing. And so these are new job opportunities and silver linings, maybe opportunities for new types of employment to emerge. And I would hope that we look at that in our area and maybe partner with the community college or educate. I've been thinking about all this stuff.
Yeah, I love it. I'm on it.
Get creative. Again, we're out of the box thinking right now how to do this where they can get a certificate or a credential for doing this kind of new work. So that's one idea I've been working on.
I talk from time to time with our wonderful chancellor of the Peralta Community Colleges District, and I'm going to bring that up next time we talk. I think that's a terrific idea.
I really, we could be the first.
Yes, again, right?
We could be the first.
This is a follow-up onto that, the test results. If the test results could be based on photos, not your ID, to allow for undocumented workers to feel safe.
Listen, however we can cover undocumented workers and immigrants, we need to do. This has been unconscionable. The Republicans won't let us do anything. And so the first bill is for anyone, the testing, okay, anyone. The immigration issue, they're trying to use, you heard the president talk about funding in terms of sanctuary cities. I mean, they're trying to find a way to do worse things to immigrants and undocumented people than they've done in the past. So we're trying to figure this out and make sure that everybody, regardless of status, has access to testing, contact tracing, treatment, and care.
This person says they're concerned that the U.S. Census was suggested to do contact tracing. They would have real reservations about this because people need to know that their census workers won't share their information with anyone. How would you address that?
I don't support that at all. I think this is a healthcare protocol that has to be established, and it needs to be within the healthcare space. No way. This is the first I've heard of that. But
yeah,
no
that was an eye-opener. I hope that doesn't go anywhere. But speaking of the census, Congresswoman, has there been an extension of the time within which to return?
I know we were talking about, I think there's been an extension until October, I believe.
I think I heard that too.
But let me encourage everybody to get your census forms in, because one, of course, people know that it determines political jurisdictions, but it determines resources, schools, community health centers, housing,
food,
food, everything.
Hospitals,
everything. So please fill out the census, and if you need any help with any information, feel free to contact my office, because I know a lot of people are worried about government intrusion, as I have always been all of my life. But we've put in some guardrails and some protections. And so I'm just encouraging you. And if you believe that you're not being, that you're getting, your information is going elsewhere, you need to let us know right away, because we have an army of lawyers who are going to take this on if that happens.
No, that sounds great. You heard it, everyone, from the Congresswoman. Get the census forms in. This is such an enlightened audience. They probably already did, but just in case, you know people, talk it up in the community, because we want, it's about power and money is what I say. It's our representation in Congress and all these important funding sources.
Right.
Congresswoman, we are so thrilled. What an opportunity, right, everybody? They would be giving you a standing ovation. They might be standing.
There you go. You have people clapping.
I can see them clapping. I can almost hear them.
Let me just say in closing, it's been really great being with you. And I want to encourage everyone to maintain the physical distancing, follow the health directives, and just know we can get out and get exercise and enjoy our beautiful area, but keep the 6-foot distance, wear your mask. I found some very wonderful places in Alameda where I don't think anybody even knows exists, where you can social distance walking or biking. A beautiful place to do that, but please, some days I see too many people without masks and too many people too close. So, Madam Mayor, I'm just encouraging people to please.
You heard it from a higher authority than myself. But I do want to share what the mayors, when the 7 mayors were on our conference call with the Congresswoman last week, one of them had the idea that we want Barbara Lee face masks. So I said, how about the covering over your mouth and nose that says, Barbara Lee speaks for me? See?
Nice, I like that.
We're working on it.
Thank you. That would be very cool.
Oh, well,
My
and
grandkids would love it.
again, we can't thank you enough. This is one of the things that I think is so important as an elected leader, as a local elected leader, is to try to keep my community informed, to try to bring them up-to-date, accurate information. I am so blessed to be a mayor in the state of California, in the Bay Area. The 14 Alameda County mayors are just working shoulder to shoulder. Well, no, we're socially distancing. We communicate on our screens or by text or cell phone, but and then to be in the state of California, where this smart, proactive governor Gavin Newsom is leading the way. It isn't easy. I know people are really itching to get back, but I really believe in Alameda that people get it. They know this is hard. It's just tough in so many ways to be socially, physically distancing, and then the worry about the economic implications.
Yeah.
They know, and we just heard it. We have a weekly briefing call, the county mayors and city managers from Alameda County Public Health, and the director was telling us this last week that you have literally saved thousands of lives just based on the modeling that they had for the Bay Area when this pandemic started. Many more deaths than we have seen. I mean, one death is too many, don't get me wrong, but we have so lowered that rate, and we can continue to do it. This is not the time to let up.
Thank you very much. Listen, you're absolutely right, Mayor Ashcroft, and I want to just thank you for your leadership and for leading the way, because this is a partnership. We're in this together, and we'll get out of it. And I'm reminded of Dr. Maya Angelou when she was, one of her poems, she said, and still we rise, and we will. So we have to keep hope alive, but we also have to be careful, and we have to know that, by us doing what we need to do in terms of all of the health requirements, we're saving other lives. And this is the time to realize we have a chance to save lives ourselves. So your leadership is so important in saving lives. I mean, that's what it's about. Okay.
Well, I think it's a wonderful partnership, and what a lovely note to end on. So thank you everyone for joining us. Thank you so much, Congresswoman, for all your hard work on our behalf. My city appreciates you so much. Everyone out there, take care, stay safe from 6 feet from other people, wear your masks, and we'll be back next Friday with another exciting guest. Not this exciting, obviously, but stay tuned and we'll let you know who that is. Thank you so much, everyone.
Thank you all very
Bye.
much.
Be safe. Take care. Thank you,
healthy.
Congresswoman. This is lovely. Thank you.
Bye-bye.